Today we've got another channel takeover from Dr. Kish, and it's the return of an old patient.
Hi YouTubers, my name's Dr. Kishan. I'm one of the cosmetic doctors at the Lovely Clinic. I'm here today with Stephen and we're going to discuss some of the objectives of his treatment. Hi Stephen, how are you?
I'm very well, thank you very much.
Okay, so I know you had treatment last year. You were one of our TLC celebrities, and in fact I'd like to sort of maybe take you back to some of your pictures and find out from yourself what you might want to improve now we've come to this stage. Because the aesthetic treatments that we do tend to build on the last treatments that we've had done. And what we find is some of our patients look better and better and better as the years go by compared to the normal sort of aging process. So having that in mind, and I know you had some filler treatment and some Botox treatment last year, let's just see if we can push the envelope a little more. But first of all, just to find out what you might want to highlight or what you might want me to focus on first.
Okay.
So if I take you to your front-on picture, let's have a look. And with this pen, you can highlight for me any areas that you think need attention.
Okay, so one of the things which I'm conscious of when I look in the mirror is all around my eyes. Mm-hmm. So it's around here in particular, that feels as if it's drooping a bit. In fact, you can see that whole eyelid there is a bit droopy, probably even the same on that side. And these laughter lines mm-hmm. here are a little bit exaggerated. And then underneath the eye here and here, it may not be something you can do, I don't know, but that does feel as if it's sunken a bit and drooped down a bit, and there might be nothing that can be done about that. I've noticed, it's not a big thing, but it was done last year and it made a huge difference, was that there was a little bit of work done in here to not necessarily get rid of the lines, which mm-hmm. weren't too bad, but to there's a bit of an indentation in the middle of my forehead there, which I don't know if it's come back or not. And one of the things which I'm interested in is, what difference has been since last year, because it has felt to me, that this, I've looked better, mm-hmm. but that it has worn off. But to what degree, I don't know, because it's not easy to tell.
Okay.
Going down the face, I'm conscious that, it's probably gravity, but here and here, if anything could be done to pull those up, and again down here, and sort of like that mm-hmm. line there and here. That's sort of like the area where I guess I'm most conscious of my face. I used to have quite nice cheekbones. I'm not sure if they're as defined now as they used to
okay.
be. But that's sort of it, really.
So everything, basically. You covered the whole face. And I actually think you've covered everything that I would probably select for you as well. So certainly if we're working from the top down, you've had treatment with Sarah before, so you know the protocol almost. I agree with you. I think I'd start with some of those lines and perhaps the little indentation you have in the forehead, and then work my way around the eyes and the cheekbones and those sort of the gap between the nose and the mouth and around the mouth and below. And perhaps your chin as well. Okay, so Steve, why don't we have a look at you with some facial expression? And you already talked about sort of the eye area and those lovely laughter lines that are actually really nice. But there's no harm in trying to minimize them, which I think we'll try. But anything here that you notice?
Looking elsewhere, it seems a bit more obvious to me now that there's a bit of an indentation in there. Mm-hmm. Just underneath the lip, the lower lip, and I always have been conscious that my these are quite pronounced, but also that my jawline in general hasn't been as strong as I'd like it to be. If there's anything that could be done in that respect, that would be great. I suppose one other thing is I have a very thin lip. I don't know if there's anything that could be done there or not, but yeah, that's about it. And this pronounces all of those issues around the eyes in particular.
I mean, what I would say about the laughter, if we work sort of from top down, I think I agree with you. I mean, those laughter lines that are there, we should minimise them. But I think if you eradicate them completely, you will look like some of those Hollywood car crash faces where they just look completely wiped out. They look like a dull, very, very porcelain skin, and unfortunately it doesn't look very natural at all. So if we maintain maybe about 3 or 4 of them, that would look quite good. And I noticed here there's a little bit of a textural change underneath the eyes, and it's sometimes you see it in people who are chronically rubbing their eyes with allergies and things like that. But I think we should try a really soft filler and perhaps some skin booster there to improve the quality of the skin there. I also notice a little bit of hooding in the upper eyelid there, and we could think about trying to either raise the brow in total, or perhaps eradicating some of the skin tissue there as well with a blepharoplasma treatment. So that this actually vaporizes islands of skin tissue, and then the remaining skin tissue of the upper eyelid starts to contract, and it becomes a lot tighter, and it gives you that look of a bit more sort of a wider awake eye. There is a bit of downtime about that, but we can talk about that as well. I think you've got really good sort of facial features. I mean, the cheeks, you mentioned that your cheekbones were a bit more defined, and we can augment that with some dermal filler, and the lip, and this sort of mental crease area here as well. I think we can do some structural dermal filler just to give you a bit more of a holistic improvement. So yes, I think let's book you in for that. And lastly, we've got one more picture to look at. Just here, I mean, if there's anything else that you notice, let's talk about it.
I mean, I think that, I've got quite a recognizable nose, and I think that my chin here doesn't necessarily, do justice to the rest of my face. So if there's anything that could be done to augment my chin, I think that would be good. Other than that, I think we've already talked. You can see the under eye issue there. There's nothing else apart from perhaps that line there, which goes down from the side of my mouth. That's a clear sign of aging, to me, and that too. So thinking about those in conjunction with the other suggestions or treatments or issues, I think that would definitely give me the sort of boost I was looking for.
Sure. I might also, so I'll suggest perhaps a little bit in the upper lip there as well, a little bit down here, a little bit of definition along the jawline. Cheeks we talked about. Certainly I agree with these areas. I think by putting some support in the chin and the jawline, you'll see that a lot of these lines and folds and shadows that you're worried about will actually be minimized naturally. So that's a really good strategy. It's a well-known strategy for sort of giving a bit more smoothness to the skin. The nose is a really recognizable nose. It's good. And you've got this slight depression here, so we might work with you to put some volume back there as well. Okay, so we've got a treatment plan in mind. Do you have any specific concerns or any questions at all about the treatment?
Will this be building on what was done last year, or will it be a fresh start from new, do you think?
I think this will be building, because you've got a little bit of structure left from last year. Some of that product will still be there, so we're just building on the foundations that you've already got.
One of the things which I really appreciated about the treatment last year was I looked like a better version of myself. I didn't look like that plastic kind of look you mentioned earlier. That's my only concern, that I wouldn't want to look inauthentic in trying to achieve something which wasn't a sensible strategy.
Yeah. I mean, I think with all of our treatments, our aim is just to make a slightly more optimized version of you. It's not really about turning the clock back. I mean, signs of facial aging are sort of shadows and creases in the face, which we can smooth out. But I think actually giving you making a slightly more attractive version of your face is really the end goal of our treatment.
Yeah, I mean, I did notice after the treatment last year that I certainly improved my confidence and self-esteem, and that filtered through into every part of my life. And I think that I want to see that sort of like reaction again, and if I can and build on that a bit, without going too silly, then that would be fantastic.
Great, perfect. Now I think we're on the same page. So we've got a treatment plan in mind. Let's see what we did.
So we start with filler for Steve, and I'm doing some Volift in his forehead. I'm placing 1 mil centrally with a cannula. I then move to Voluma and place 1 mil on each side to get some structural support. I'm now using Teosyl Ultimate in the cheek area, again with a cannula, to build volume. Switching back to Voluma, I place 1 mil in the nose. I then treat the alar base or nasal base with 0.5 mils of product. I now switch to Juvederm Volux and treat the chin area with 1 mil. I'm now switching to one of my favourite products, Ready S, and I use this to sculpt his jawline, and I use 3 mils of product. Now the jawline is sculpted, I move on to Juvederm Volift and treat his lips with 1 mil. Now we have structural support in the cheeks, I move back to Voluma and start to work on the deflation of the fat compartments with 2 mils of product in a cannula. To finish off with the filler treatment, I move on to Profilo and I place 4 mils in the face and neck to work as an injectable moisturiser and to get some skin tightening. And to top off his treatment, I do a little bit of upper face Botox. Okay guys, welcome back. It's been 6 weeks since we saw Steve for treatment, and welcome back. So how has it been?
Fantastic. Thank you very much indeed.
Okay, so fantastic in what way?
Since I've had the treatment, and this is the second treatment I've had. I had my initial one about a year ago, so it was all a dive into the unknown at that point. But on this occasion, I have felt it's been much more natural, very minimal discomfort. My expectations, are in line with what reality is. So it was a very simple progression. I knew there would be some minor discomfort for a few days, and there was, but nothing unmanageable, and I was able to work. And to the outside world, although we had quite a lot of treatment that we decided upon, it wasn't something which anyone else noticed at all. And I was very pleased with the results from the word go.
Good, perfect. So are there any elements of the treatment that you particularly liked?
I think my favourite one was the one that actually surprised me, was the nose straightening part.
Okay.
That was something that, really did make an impact. I have always been slightly sensitive about the size of my nose, even though people tell me it is a character statement or something like that. The fact is, this has actually helped to straighten it out a bit. So it was quite a minor part of the whole process. But it was something which I could notice quite quickly, and I was surprised. I hadn't even thought about it until you suggested it.
Yeah, I mean, I don't often point out things to patients because I don't want anybody to think there's anything wrong with any of their features, but when we're doing something like this and we're working on the areas, I thought, well, there's a little bit of a bump, maybe we could just straighten that out a bit for you, but keep it natural so no one will really know that you've had it done. But I'm glad it's made you feel good.
Yes, and the other thing which we did, which I felt has been really good, is strengthening up my cheekbones.
Yes.
So that's something which I think has, made me look perhaps, more handsome. Maybe that's not the right thing to say.
The right thing to say.
But it's something which I can see. And what is interesting is, although we had a lot of different treatments, it's not something which I can even see or notice, obviously, but a part of the cheekbones I can.
Yeah. So I think with these kind of full face treatments, it's difficult almost to pinpoint like one area, because we're working in so many areas and all of them in combination together kind of bring that final result. But we did a lot, and I'm glad that you've been happy with the results. Is there anything that you would particularly do again in the future?
I think that all of these things, what's been obvious to me is you can't just do one element. And what I thought was the problem, especially when I came the first time, what I realise is it's something where you need to take a more holistic approach.
Yeah.
So there are lots of things which are pointed out on both occasions, and of course I remembered a lot of it from the first time I'd been, that I would never have even contemplated. So I think the truth is that I am probably not a very good judge of what I need. And so actually coming here and having an honest conversation and a discussion with an expert put me at my ease. And it was actually a relatively easy decision for me to go for the entire package, and certainly the second time around, I think we went a bit further, and I was very comfortable with everything that we did.
So one thing I would like to talk to you about is that you had some filler in your lips.
Yes.
Now, I often get asked from male patients, what are lip fillers all about for men? I don't want to look feminine. I mean, clearly yours don't look feminine.
No.
So what was the decision-making process behind that? And if you could reassure some guys thinking about it, perhaps, how it goes afterwards?
Yeah, sure. That was, funnily enough, the bit where there was the most instant discomfort when you have the surgery. So it's quite a painful prick into the lip. But after that, it wasn't noticeable. So the reason behind that is I particularly had a thin upper lip, and so we were only talking about a very, a marginal treatment to not create something which looked odd or wrong or unmasculine. For me, it was because I think I'd had the confidence of going through this the first time. I was very comfortable with going through it a second time, and I can honestly reassure anybody who's had it that I certainly haven't had any regrets. I think that it's helped the overall balance and look of my face.
Yeah, I think it looks good. So is there anything that you would maybe like to try in the future?
This time I stopped short of one treatment which you recommended when I first came in, which was plasmage.
Okay.
And I did that for a number of different reasons. One is it took me slightly further out of my comfort zone than I was willing to go at this time. Secondly, the downtime meant that it didn't suit me on this occasion. Everything else, there was no downtime whatsoever. I was working immediately with clients face to face, and it was fine. Although I was aware of a bit of what should I say, swelling and difference. Nobody else was.
Yeah, that's good. That's good.
So with the plasmage, that's something that I would consider in future. But again, that's not something, I could say definitely at this time.
Yeah, just a consideration. So for anybody watching at home that doesn't know what plasmage is, it's a plasma treatment. So it's a high energy treatment for the eyelid area and sometimes under the eyes as well. And we make small little burns on the skin. Sounds crazy, but what they do is they contract the skin at the site, and then in between the sites of healing, you get a lot of collagen stimulation. So for anyone with any excess skin above or below the eyes, it can really tighten that up and improve the skin quality. So yes, you are right, there is some downtime with it. It will be about 5 to 7 days downtime. Sometimes people have more. So yes, definitely one to plan around a work schedule, and I know that wasn't right for you, so I think it was a good idea that you avoided that one on the day.
So there was one other thing I'd like to mention, and that was the work around my jaw and chin. Okay. So I have been aware of the fact that I have what I would perhaps call a slightly weak chin and jaw line. I wasn't aware of the jaw line, but that was pointed out to me. That was part of the overall solution. So we had quite a lot of work done there, and I feel that was really worth it, and really feels like it strengthens my jawline.
Do you feel that the change is at the front, or is it from the jawline aspect at the side, or a bit of everything? What would you say?
So the bit which I feel is the side bit. So that's the bit I can physically sense.
Yeah.
But the bit I can physically see is the front bit.
Yeah, okay. So we used a product called Radi-S in the chin, which is quite nice for male jawline. It's quite firm, so it does give good definition. But like Steve says, you can feel it, especially at the sides beneath the skin, for the duration of it being there, which is about a couple of years. But as long as it looks good, it doesn't tend to bother people too much. It's something I can feel, but not in a bad way. Yeah. It's just, it sort of feels like my face is all times.
Feels like my face has changed shape slightly in that area, and that feels good.
Yeah, excellent.
Obviously, my motivation for doing this was I wanted to look as good as possible. Yeah. I wanted to, if possible, I know we talk about looking the best you can for your age, but I wanted to look younger too, if I'm being completely honest.
Yeah.
And I feel that this has helped me in that respect. But this is part of an overall series of things which I do. So I eat well, I exercise well, and I make sure I lead a good, decent, healthy, lifestyle. But this feels like an important part of what I can do to help me lead as good a life as possible. And it wasn't just the fact that I've changed the look of how I am on the outside. It's actually been something which has really given me additional confidence and improved my self-esteem in ways which I think I'm only aware of because I've done this twice, and I felt the same way after I had it the first time. So this has been another boost on top of that, but it feels like something real which I can use to further improve my life. So I'm very grateful that I've had this done.
You're very welcome. So again, this is something that people do add into they're healthy, they lose a lot of weight, and then everything's great, but they notice some changes in the face, and small tweaks gives you confidence, leave a good life. It's up to each individual what they want to do, but certainly for many of our patients, having these small treatments really does make a massive impact. So I'm glad you brought that up. Thank you.
Thank you. And in fact, since I had the treatment, I've lost about half a stone in weight without putting any great effort in. It just feels like it's helped me to change myself from eating the wrong things into eating the right things.
Good. So it's had an impact on your whole life then, which is fantastic. So finally, are there any comments that anyone's given you? And did anyone notice or not notice?
No, I've had general comments that I'm looking good at the moment. Nobody's said, have you had anything, but you look different, you look well, you look better. And I think that this is, just my little secret for the world. I'm not embarrassed about it. And if anyone wanted this treatment, I would definitely speak openly about it and recommend they had a look and decide if it was for them or not. But I have had a lot of comments from family and friends who've talked, about how well I look generally without being able to understand why.
My work here is done, guys. Thank you so much, guys, for watching this video. I hope you enjoyed it, and thank you to Steve again for being such a fantastic patient. If you have any comments, leave them in the section below. Remember to like and subscribe, and we release videos every 2 weeks, and we'll see you soon.